So I'm here to talk to you about the patient at the center of the care. So my name is Debbie Watson, and since 2008, we have been doing this at my hospital at the McGill University Health Center. So what we do is that we create, implement care pathways, surgical care pathways, and we try as much as possible to implement the elements, all the elements of ERAS into them. Today, I'll talk to you about, I'll define patient-centered care, and I'll explain the importance of patient-centered care and how you can increase your patient-centered care approach. Leaders of the U.S. Department of Health and Human Services urge providers to improve the overall quality of healthcare by making it more patient-centered. Patients as partners in care. Patient-centered care is now a recognized model of care, and in this new paradigm, patients' beliefs, values, and knowledge are important elements in the discussion about the care plan. I'm going to give you a couple of definitions. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guides all clinical decision. Morgan and Yoder defined it as a holistic approach that is respectful and individualized, allowing negotiation of care and offering choice through a therapeutic relationship where persons are empowered to be involved in health decisions at whatever level is desired by that patient who is receiving the care. Patient-centered care provides a mechanism for nurses to engage patients as active participants in every aspect of their health. I found that there was commonalities with these definitions. I found that they focused on the patient's needs, the patient's control, the interaction between the patient and the caregiver. In 2007, the Joint Commission reported communication breakdown as the root cause of 65% of errors. In 2009, the Joint Commission added effective communication among caregivers as a national patient safety goal. Allison and George say that teaching and communicating with patients while obtaining patient information can have a profound effect on the quality of the patient's experience. Communication is key to preventing errors. Inadequate communication between the patient and the healthcare staff is one common reason for patient dissatisfaction. I wanted to mention this to you. I think it's a great program. It's a great educational program. It's available for everybody. It's on the net. It's called the Ask Me 3. The Ask Me 3 is a registered trademark license to the National Patient Safety Foundation. And the Ask Me 3 is a patient education program designed to improve communication between patients and healthcare providers, encourage patients to become active members of their healthcare team, promote improved health outcomes. The program encourages patients to ask three healthcare providers just 3 questions, very basic questions. I decided to show this to you. This is Speak Up. We have this in our patient booklets. And more, I'm including them all in all of our booklets. So in the table of content, it is written Speak Up. And basically, it's the Ask Me 3. There's 3 simple questions. And the questions are, what is my main problem? What do I need to do about it? Why is it important for me to do this? Recent studies show that the Ask Me 3 adds structure to provider-patient communication. Patients sometimes are not that sure of how to start a conversation with their surgeon or their physician. That helps. It increases patient satisfaction with each visit, decreases the number of missed visits, reduces the number of callbacks, and apparently does not add significant time to the length of patient visits. That was a good one, but you know, I had great difficulty finding qualitative type studies. I wanted to see what was out there for patient experiences. Us nurses, we have a lot of work to do on that, let me tell you. Anyway, I found this by Bernard and Foss that just came out in 2014. It's a qualitative study using semi-structured interviews aiming to explore the experiences of patients who receive care as part of an ERAS program. The participants reported many positive aspects of their ERAS experience and favored the program, particularly because home was the preferred place for recovery. But on the other hand, participants faced challenges during their experience of the ERAS program, most prominently in relation to home convalescent. This study emphasizes the need to equip our patients with the information to self-recover and to provide the community also, the community health professionals with the knowledge of how to support ERAS program. I'm not so convinced, actually, well, in Canada, that we've done this well enough. I'm not sure that the community nurses know exactly what is ERAS. I go to schools, CEGEP nursing schools, and I talk about Preop. And recently, I went to the person who is in charge of the whole program, and I said, how about next year I come back and I start to talk about ERAS? She didn't know what ERAS was, but I think I'm getting there. So I think that next year I will be presenting in a nursing school about ERAS, and that's exactly what we need to do, not only in hospital, but in the community. So because these patients wanted to know a little bit more about at home, I decided I'm going to show off a bit, and I'm going to show you our booklets because we do cover that. So we have give instructions for home, and we cover, well, the first line you can see, complications do not happen very often, but it is important that you know what is normal and what to look out for. So we cover pain, we cover incision, we cover the bowels, the diet, the exercise and activities, and at home. So call your surgeon if you have Patients need to know this. They need to have phone numbers. This is an interesting one. Patricia Dykes is one of the authors of this study, and we were fortunate enough to have her as a visiting nurse at the Nursing Research Committee Day last year, and she presented this, and it just blew me away. So her study was Bedside Information Technology to Support Patient-Centered Care. And the purpose of her study was to identify the data elements that will be used to define requirements for a bedside communication tool in an acute care hospital. So that was in Boston Hospital, and it looked like an iPad. It was a mixed method where there were interviews followed by survey. There were 60 participants, 30 nurses and 30 patients, and they had to complete this survey. And they had, each item was rated on an 11-point scale from 0, they didn't want it, to 10, yes, very important to have it on this iPod. Well, the reason I'm showing it to you, because I want to show you what the patients wanted to have on that iPod. The 5 items patients believed to be most important were knowing explicit plans for the day, knowing their schedule, knowing their recovery goals, room orientation and general hospital information like cafeteria, garage, and so on, and being able to access one's own clinical information. More and more, we're going to have this with the electronic medical or the electronic health record. Patients are going to be able to access what's there eventually. This is what it looked like. So on the left side, you can see you have the nurse's name for that day, the attending staff, if there was any scheduled events. Patients also wanted to see the weather, so they had the weather on their iPad. If they click medication, they had the list of medication that would open up. Beside each name of medication, they had a little eye, and if they click on that eye, it would bring them to WebMD, and it would explain what was the medication and so on. Anyway, this blew me away. Of course, we don't have the funds where I am to have this, which I'd love to, but we decided, well, we'll do something similar, but a little bit cheaper, and everybody in here can do it also. So we got whiteboards, and we wrote the patient's nurse and the PAB and the doctor, and most importantly, we wrote goals for the day. And here's another one with goals of the day. So I think patients want to know what's going to happen that day. Okay. And this is our booklet. This is Postop Day Zero. As you can see, it's detail, what you're expecting, and Postop Day 1, and I'll tell you a funny story with that. Some of you might have heard it because I've said it often enough, but I think it's so cute. So it's 7 o'clock in the morning, and the patient is in bed, and the residents are rounding, and we just started these booklets, by the way. And the patient has his booklet on his thigh, and he asked the resident, when will his Foley catheter be removed today? Because according to his booklet, it was supposed to come out. And I went, yes, that's exactly what we wanted to do. We wanted patients to ask questions. So the resident went back to the surgeon and go, did you change something recently? Because a patient just asked me about when his catheter is going to be removed. So this is 1 day, and then 2 days. And again, every day is specific activities, what to expect. And 3 days, we're aiming to go home. And we also did a family board. So we have in the hallway, we decided to do, and it's for families, parking, cafeteria, hairdresser. When I do patient education material, I also evaluate it. So I created this evaluation, and I evaluate about 10 patients. So I go meet with them, and I ask, I find this booklet useful, and so on. But why I'm showing this to you, first of all, I'm showing it to you because it's important. If you're going to have a patient education material, you need to evaluate after. But I decided to go a little bit step further because I wanted to know what the patients wanted to hear when they were coming to the Preop Clinic. So what are you most interested in finding out when you come to the Preop Clinic? And these are all answers of different patients. But I like this one, general condition after surgery, recovery rate, days, weeks, being prepared step by step, what will take place on the day of my surgery and the operation. And the last one, I thought it was pretty cute. How do you see yourself using this booklet? When would you refer to it? One person answered me, every time I need an answer. The other one said, it's a great reference booklet to refer back to when you go home. It's a big help. I know. I don't know why he knew, but probably had other hospitalization in the past that didn't have a booklet. So this, I'm going to recommend it. It's free, and I think they have very good strategies. It's called Agency for Healthcare Research and Quality, so how you can increase your patient-centered care. This is what it looks like. It gives you 4 strategies, and one of them is nurse bedside shift report. We are going to see this more and more. At my hospital, we're not there yet, but very close. And I think there's a lot of papers that are written about bedside shift report, having the nurse that's leaving and the nurse that's coming on with the patient giving report. So encouraging and including a patient-centered handoff of care results in improved accuracy and promotes safe patient-centered care. It gives the patients a chance to contribute and to correct the information on the record. So overall, how can we increase patient-centered care? I think we need to encourage patient communication at all levels. We need to create patient education material and evaluate them and modify them when need be. Patient satisfaction questionnaire, and that could be very easy to do. You put it up behind your booklet and you do a little drop box on your floor so they can just drop it in the box before they leave to go home. Explain the discharge criteria in plain language. It is not easy to write in plain language. We have a tendency to say too much, give too much detail, and we lose our patients. Provide information after discharge from hospital. Include what's normal, what's not, when to phone or come back to the hospital. This might even prevent a visit to the ER by having this said. And try to give phone numbers. I think it's helpful and appreciated. Thank you very much.